For laboring patients needing a cesarean section, or for elective C-section patients, a spinal anesthetic is the preferred mode of anesthesia if there is not an epidural already in place, or if the labor epidural is not working well. Before your C-section, an anesthesiologist will come to your room to discuss the risks and benefits of spinal anesthesia.
Hi there.
Hi.
I'm Dr. Ismail. Nice to meet you.
Nice to meet you.
Nice to meet you both.
You're just the person we wanted to talk to.
Great. Well, I know that you're going to be having a C-section. I've reviewed your health history. It looks like everything is in order. Do you have any particular questions or concerns?
Yes, I'm terrified of needles.
Okay.
I'm really worried about having a spinal. So is there any other way to do the surgery?
Well, there is. General anesthesia is another option that we can use to allow you to get through the surgery comfortably and safely. However, we only generally use that type of anesthetic where you're completely asleep for emergencies or when there's a contraindication to a spinal. So most of the time we like to do a spinal anesthetic so that you can be there for the birth of your baby and be able to bond with the baby at that time. And it is the safer of the two options. Okay.
That makes sense.
Okay. So would you like to hear about the risks of the procedure itself, the spinal?
Yeah, I'd like to know what the risks are.
Okay. So there are risks for bleeding and infection simply because we're going to be placing a needle through the skin, just like when you had the IV. As far as the infection risk, it's greatly minimized by the disinfectant that we use to clean off your skin before placing the spinal. Okay. As far as the most common risks, there can be something called a spinal headache. It happens in about 1% of patients, so not that frequent, where you will have a headache, and you'll notice it in the first 24 hours after the procedure. There are very easy ways to treat it, so we'd like to know if you have any of those symptoms. And then finally, nerve damage is always a risk, but it's very rare because we place the spinal just below where the spinal cord ends, so that greatly minimizes that risk.
Will I feel anything else during the C-section?
Sometimes actually you do feel nausea, shivering. Those are some of the common things that you might experience. Nausea is very common. It has something to do with blood pressure changes. Let me know if you do feel anything right away so I can give you IV medications to help treat it. Shivering just kind of comes along with extra adrenaline during that procedure, during that time. So that's something that just kind of passes on its own. Other things that you might experience that are still normal are sometimes shortness of breath, chest pain, even shoulder pain, which kind of dissipate after surgery. If you do have any discomfort that gets to be too much for you to bear, let me know. I can give you some extra IV medication for that.
Are you going to be with us the whole time?
Yes, I will be there the whole time with you. You can also bring 2 additional family members with you in the operating room to be with you.
Great.
Okay.
Now that I've learned a lot more about the spinal, I feel comfortable, so.
Perfect. I think it's the best, most safest way to proceed.
Okay.
And we'll go ahead and meet you in the operating room. I'll let the nurse know that you're ready.
Thank you so much.
Okay, you're welcome. Thank you.
Certain health conditions, medications, or emergency situations may counter the ability to safely administer a spinal anesthetic. In these situations, a general anesthetic technique is used. Family members may not be present for the initial administration of general anesthesia and the placement of the breathing tube, but may be allowed into the operating room a few minutes later for the delivery of the baby. There may be several other staff members in the operating room, including your obstetrician, a surgical assistant, a circulating nurse, a scrub tech, and a neonatologist. They are all essential and there to help care for you and your baby.
I will let you know what I'm doing every step of the way. Okay? And first thing I'm going to do is clean off your back with a cold soap. Okay? So here's the first 3 times.
That's good.
Get to meet your baby. Next, I'm going to put
Proper positioning is one of the most important aspects of receiving a spinal. The better the positioning, the faster and easier it is for the anesthesiologist to place the spinal. The anesthesiologist and nurse will guide you into the proper positioning.
Go ahead and start to get into that position.
So remember, slouch those shoulders and knee
down to your chest.
Move that front up that
Perfect. Okay? And I'm going to do a little bit more feeling just to find the right spot.
Like this?
That looks great. Try to keep it in that position. Where you feel my finger, I want you to push against that. Perfect. First thing is part of the procedure is the worst part. It's going to help the rest of the procedure go a lot more smoothly. It's the numbing medicine, okay? Okay. Okay, on the count of 3. 1, 2, 3.
Because the spinal needle is so thin, an introducer needle is placed first to puncture the skin.
Now you'll feel some pressure with the next step, the needle. If you feel anything pokey, let me know. I can start with more medication before I advance, okay? Okay.
If you are experiencing contractions, the anesthesiologist will try to work in between them as much as possible. However, there may be certain parts of the procedure where they will have to continue regardless of a contraction.
Hold your position. Perfect. You'll start to feel numb and tingly in your legs and your bottom quickly. In order to get the medication to settle in the right spot.
Although it usually only takes a few minutes to place the spinal, finding the right position can take longer depending on the individual patient's anatomy and size. As the spinal needle enters the spinal fluid, it is also common to feel pressure or a funny bone sensation down one side or the other. This sensation usually passes quickly. It only takes 4 or 5 minutes from the time of spinal injection to when the effect is adequate to perform the C-section without pain. During those minutes, your nurse will place a Foley catheter to drain your bladder and will wash your belly with disinfectant to prepare for the surgery. Once the drapes are on, and immediately prior to beginning the surgery, the obstetrician will test one final time to make sure the spinal is working adequately to continue.
So I'm going to test and make sure you're nice and numb, okay?
Okay.
Pinch you really hard. Feeling anything?
Just a little bit of pressure.
That's great.
Exactly what we want.
After the procedure, you will be moved onto a stretcher and taken back to your room to recover from the spinal anesthesia. Sensation usually returns within 2 or 3 hours, but some areas may take a little longer. Along with the spinal medication for the C-section, the anesthesiologist will also add a long-acting pain medication that will help with pain control for an additional 8 to 12 hours. If you do have increasing pain as the spinal wears off, let your nurse know and they will be able to administer additional IV pain medication as needed. There is also an anesthesiologist in the hospital at all times if you have any additional issues, comments, or concerns.